Gloria Cantu, are you in Edinburgh? Can you hear Dr. Sparling? Can you hear us at the center? Veronica Arredondo, Del Rio. Well, I'll continue. I thought today what we would cover would be several areas. Again, folks, this is not set in concrete. Health policy and financing issues. Some of the things I'm going to talk about today is Medicare reform, patients' rights with regards to privacy, patients' rights with regards to the Bill of Rights that are being considered, fraud and abuse, the HIPAA mandates, and I'll be covering what these acronyms mean, Medicare prescriptions, the new president, what he is proposing for his health plan, and a little bit of review of the Balanced Budget Act of 1997 and what impact that's had on healthcare delivery in America. Managed care, we can talk about that a little bit, and then prescription drugs. Y'all excuse me, but I'm going to be using these overheads to sort of elicit discussion, etc. Medicare reform, of course, with the Clinton administration, everybody's pretty much aware of what they were trying to do. The Bush administration has on its agenda the privatization of Medicare, and pending Medicare bankruptcy. I think all of us have heard that Medicare is going to go bankrupt one of these years. There's been estimates that it would go bankrupt in 2002, and then they had a re-estimate on 2008 and 2015, and Congress is trying to figure out what they're going to do with the surplus and whether or not they're going to apply that to Medicare and Medicaid. So who knows what's going to happen with regards to when Medicare is going to go bankrupt. Now there's several Medicare proposals in the works. Senator Breaux, Frisk, and Thomas are talking about a premium support, which would be expanding Medicare plus choices, and I'll talk about that a little bit more. And then Senator Graham's private self-controlled Medicare investments. Now, if you notice, these are Republican senators, and more than likely their emphasis is going to be on privatization of the Medicare program. Now, of course, there's a lot of opponents, primarily the Democrats, that are going to be dealing with that. And I'll come back to that in just a second. Now let's go over to patients' rights, privacy. Clinton's new rules imposed a burden on providers protecting the privacy of patients' medical records. Now, I'm kind of new at this, folks, so if y'all have some questions or something like that, please ask it, okay? Because I'm used to interaction on my presentations. We do have teleconferencing. I have an executive program where we do teleconferencing with our students who are at different bases, but this is a little bit different for me, so y'all stick with me. Medical records are something that's being discussed in Congress right now. No decisions with regards to those medical records. Again, rules and regulations are being promulgated, and discussions on those have to go through the various Senate and House committees to see what they're going to be doing with those. The thing is, though, folks, is that the privacy is immensely popular with the consumers. They're very much concerned about their patient records being used by all types of health providers. And of course, the providers are saying that the new rules are too costly and they're not going to be able to implement those. Now, that's going to be a big battle. And some of the leading senators are saying, especially Democratic senators, are saying that privacy of the medical record is something that's extremely important, and that they feel like that some legislation will be passed within the coming years with regards to the rights of patients and their records. Providers are saying if they have to get consent from everybody and they can't use the records for research and various other things, then it's going to really be hurting their ability to bring reform about too. I don't know how many of y'all have heard about patients' rights in terms of the Bill of Rights. Final rules go into effect January the 1st, 2002. Now, all of the health plans with this patient Bill of Rights, which has been discussed by Clinton, Clinton's the one that really pushed this, and now I don't know if the Republican Congress now will try to decide whether or not they're going to go along with this or change it a little bit. But the Bill of Rights essentially say that health plans have to decide a request for treatment within 15 days, 72 hours if medical care is urgent. And then they have to rule on an appeal within 30 days of it being filed, 72 hours again for urgent care. They have to inform the patient of the specific reasons why a claim has been denied and then provide an appropriately trained professional to review disputes. Now, if y'all have followed the news, you notice that there are a lot of people who are very much concerned about the care that they're receiving from managed care. They feel like that care has been restricted, and so these new rules give the patients a little bit more clout in terms of dealing with providers. Now, it's interesting to note that the Health Insurance Association of America states that regulations could cause employers' health care costs to increase by millions of dollars. Now, you're going to find this all along, folks. The rights of patients and how that is juxtaposed, I guess, to the rights of providers. So the situation is that in the coming months, again, you're going to see a real fight between the providers and the congressmen who are supporting the rights of patients in terms of what are we going to do to make sure that people receive appropriate care. So that's going to be another big issue. I don't know, let's see, can you show this on the, as you can see, Patient Bill of Rights, they have vested interest here. You have the demos who are saying, well, we should have the right to sue, and they're in the laps of the trial lawyers. And then you have the Republicans who are saying, well, keep costs down, and that over here is the insurance industry. So there are very powerful lobbies, folks, that are trying to say, you know, let's keep the rights of patients down because the cost is going to be too exorbitant. And then there's others saying, well, patients should have some rights with regards to the level of care that they're receiving. Another issue, something, folks, that's just godly, it's really something that's hitting the healthcare industry really hard, both medical practitioners and medical organizations, and that's fraud and abuse. I don't know how many of y'all in your respective organizations have compliance plans, but it is extremely important, and it's also mandated by law, that you have a compliance plan to make sure that there are no abuses being taken place in your organization. I don't know how many of y'all are aware or not, but the Columbia Hospital Group, which is now known Hospital Corporation of America, HCA again, was fined close to $750 million for fraud and abuse with regards to reporting areas, and I think these just came out the last couple of weeks. They had built up a war chest of over $1 billion in anticipation of being hit by the federal government. You're finding a lot of physicians and others who are now being evaluated by the IRS and various other entities, and if they find that these people are miscoding, doing any fraud or abuse with regards to medical records or patients, then they can lose their practice, they can lose all of the equipment that they have, everything. So it's getting pretty tough on not only healthcare organizations, but also on physicians and various other entities. So fraud and abuse is something that is rampant in the field. I think the public has gotten a real bad view in terms of the healthcare industry as to the abuses of the healthcare system. So there are some estimates that there's $20 billion that are being wasted with regards to fraud and abuse. This will be something that the feds will be following up. They will be going in and they will check in medical records of healthcare organizations, and they will be checking also on physicians' records, anybody's records, anybody, and they can go back, and then you've got fines that can, well, put you out of business. I think there's been several doctors that have been charged where they took all of their equipment, took office, took everything. And I think that to a certain extent, some of them may be facing jail sentences. So this is something that every organization should be very, very much aware of, and that there are consulting firms out there, and there are also rules and regulations by the feds with regards to compliance. Extremely important. HIPAA mandates. This is something that is going to really have a tremendous impact upon healthcare organizations and healthcare providers. HIPAA is a health insurance, I'm trying to think, HIPAA is Health Insurance Portability and Protection Act. And what this essentially does, this new legislation, and it's supposed to be enacted this year, and they've only got about 33% of it done, but it is now moving the healthcare field, protocols, medical care into the computer age. And the HIPAA mandates state that you're going to have transactional guides and implementation guides. I don't know if y'all, something that'd be similar to this would be protocols for physicians, for hospitals, for every medical procedure that's done. New identifiers, how do you go about developing a better protocol to treat specific problems, medical problems. And then you have aggressive timetables. I think these were supposed to be implemented probably by the end of this year, but like I said, the federal government will not be able to do that at all. It has enforcement, broad applicability, and some of the issues that they're talking about is security and private and confidentiality. Now, just to see what this HIPAA mandate does to healthcare organizations, if I can show you this, I don't know if this is going to show up too good on the form, but what they're trying to do is develop a national integrated electronic healthcare data network where they'll put together employers, the DOD, Department of Defense, federal healthcare programs, purchasing cooperatives, health plans, Center for Disease Control, rural healthcare, long-term care facilities, home health agencies. As you can see, folks, this is going to be a task that the federal government's going to be spending several years on. And I think that they've been a little bit, planned a little bit too little with regards to trying to integrate all these through electronic healthcare data network. And so you're going to see now that whenever you're going to get paid by the federal government or anything else like that, I think all of y'all are pretty much aware of DRGs and the prospective payment system for ambulatory care, and they're getting ready to do that for behavioral health and everything else. But they will have certain categories where they will pay just a certain amount. And so trying to get all this data together, though, is going to be a very difficult thing. And whether or not the federal government can do that, I don't know. Medicare. Medicare, again, I'll be jumping back and forth on Medicare. Some of the political issues that we'll be dealing with, of course, all of you know it played a major role in the campaign 2000, and it is going to continue for 2002 because both of the candidates and the new president stated that it would be a major part of their platform. Financing issues, how do we pay for it? For those of you who are here in Texas, I don't know if y'all heard over the news the other day, you know, we had a big surplus in the state of Texas. And all of a sudden, the House, or our legislature said that there's no money available simply because of the extra costs that we're going to be incurring because of the Medicaid program and the CHIP insurance program. So all of a sudden, all that amount of money that we had as surplus is being used up immediately. So, in the same way with the Congress, they've got so many priorities that they're trying to fund. And of course, Bush has his tax cut on the table, so that means that there's a possibility that healthcare may be taking a lower priority than it has been in the past. Coverage issues, who gets it? That's a question that Congress is going to have to resolve. Who's going to manage the benefit? Again, a major issue. Pricing issues, pricing controls on health care, on prescriptions, etc. And then the industry issues is how will it affect future Medicare financial solvency. I don't know how many of y'all are aware of it or not, but the situation with healthcare organizations is at a point, especially with the BBA, which I'll discuss here in a second, has had a tremendous financial drain on the ability of hospitals to provide services. So these are some of the issues that the Congress is going to be trying to decide. I'll stop right now and see, is there anybody that has any questions or comments about some of this stuff? Again, folks, what I'm trying to say, I guess with regards to this presentation, I wish I could tell you some concrete things in terms of what's going on with Congress, but with the new administration, all kinds of new bills are being contemplated. Bush is trying to come up with some ideals with regards to how to deliver health care services. So I guess the main thing that I could tell you at this point in time is just keep reading papers and keep up on what administration is doing with regards to health care issues. Now, let's move over to Bush. Yes, yes, ma'am. Does somebody have a question?
You know, since you mentioned that Bush and the Republicans are for privatization, I want to know, what are some of the dangers of privatization?
Well, privatization probably means that you have a situation where if you privatize it, then and you set up a certain amount of money, and you're going to let other providers ensure whether or not an individual gets coverage. What if those providers become insolvent and are not able to carry out their promises? I think one of the things that you need to see, or that I should read here in just a second, is about the Medicare HMO program, trying to privatize it a little bit. But it says here, out of 237 Medicare HMOs that were started, only 90 still are still in existence. And they said out of that 90, 37 are losing money, and only 22 of those have earned any financial gains. It said here that the WISE rating said is recommending that seniors that are considering returning to regular Medicare or that have HMO Medicare should return to the regular Medicare program and buy a good Medigap policy. Now, the privatization issue too is one that the Republicans say, well, if we privatize it, then we're going to be able to jump into a competition type market, and that will hopefully lower the prices that we pay for health care. On the other hand, who's to say that as you privatize it, that as costs increase, then the consumer is going to have to pay more and more of that health care cost, and essentially that's what we're working for. Did you have any comments or about privatization too? Are you for it or are you against it?
I wanted more information on it. I'm worried about what you just mentioned, the fact that a lot of these companies will go, will become insolvent, and I worry about the consumer having to pay more.
I know it, and as you look at the cost, who am I speaking to?
Rosemary, Valladolid, in El Paso, Texas.
Oh, okay, Rosemary. Rosemary, there are a lot of seniors who are very much concerned about privatization, and with the Republican administration, there is a lot of emphasis, and they do have the power in Congress to try to push that. So, it's important, I think, for individuals to contact their congressman and let them know, that there are some concerns about privatization. Rosemary, let me go over some of the things that the new President Bush says, okay, and maybe we can discuss that a little bit further. Some of the comments that Bush has made, if I can correct this. I will strengthen Medicare by adopting the BRO premium support concept. Now, I'm going to talk about that here in just a second, okay? I support a prescription benefit for Medicare. He ran on that. We need to consider raising the age of Medicare eligibility to 67. And then we need to expand MSA, medical savings accounts. I think all of y'all have heard about that, and give tax incentives to the uninsured. And then give block grants to states that encourage private insurers to offer cheap insurance to the uninsured. Now, Rosemary, here's another thing that they're saying is that block grants and getting the federal government out of the Medicare business, and there's a lot of problems with that. And then give patients a Texas right to sue their HMOs. Now, those of you who think Texas can sue their physicians, they can't. Okay, the federal law states that health care providers cannot sue, patients cannot sue their health care providers. They can go to court and they can, get better treatment and they can get the cost of their care, but you cannot get damages or any other thing, loss of wages. Well, you can take loss of wages, but the Texas right to sue is very, very limited, and the federal law limits what you can do. Now, that first comment that I made, I will strengthen Medicare by adopting the BRO premium support concept. Now, BRO, Frisk, and Thomas are three very, very powerful Republican senators. And they want to push premium support, which changes Medicare into a system of private insurance plans with traditional Medicare as one of the competing options. Excuse my spelling, folks. I guess I need glasses. HIPAA is replaced by private market competition. Now, Rosemary, that tells you right there that the Bush administration is very much considering trying to change drastically Medicare as we know it. In this plan, government gives all beneficiaries the premium support to help buy the plan they want. It's sort of like a voucher program, folks. The government say, okay, Rosemary, we're going to give you $350 a month, and you go out and buy the plan that you want. The thing is, Rosemary, if there's no plan out there that you can buy for $350, that kind of leaves you out in the cold. The premium support is set at 88% of the trading year's cost. People choosing more expensive plans pay additional premium out of their own pocket. The issue is that the minimum amount that they're going to allow you for Medicare or for your health care expenses if you are over age 65 means the possibility that you're going to have to pay even more out of your pocket at that too. With this plan, over time, traditional Medicare is expected to be priced out of the market. Now, a bunch of critics says it welfareizes Medicare. So essentially what it's saying, those who can afford health care insurance can buy it, and then they will establish a minimum level of health care for Medicare. I personally do not feel like that's going to be a situation that is going to be acceptable to the American public, but there will be a big push towards this. And again, if you look at the Republicans, they're saying that if we can develop a health care program that encourages competition, then we're going to be able to drive down the cost of health care. That remains to be seen, but as health care continue to increase, even more so than they've had in the past year, then that's going to take more and more of the federal dollars, and so more and more issues with regards to how you control costs are going to come into play. So this is one of the options that they're saying.
Well, if they do away with Medicare or with HIPAA, who's going to be responsible for regulating all of these different groups to see if they do what needs to be done?
Well, what is your name?
I'm Donna Davis.
Donna, I don't think that's really been discussed at that point. I think that they would probably have maybe the government accounting office or someone like that, that you would put in. But I think the government, in essence, is going to just say, hey, y'all take it, And then if there's some abuses, then they might send it to Attorney General or whatever else, you know, that they might do. But right now, in terms of the mechanics of carrying this out, this is just a broad conceptual thought process by them. And so, you know, but you have to be aware, all of us, providers and the American public, have to be aware of what Congress is doing, because it can have a tremendous impact upon our ability to receive health care as we get older. So it's very, very important. Bush's Medicare cure, the Bush version, 10-year cost at $1,588 billion. He calls it the non-Medicare solution. And again, just going over this, proposal includes providing block grants to states for coverage, giving direct aid to the poor. Now, this is the key. If under $9,000. Now, if you have somebody that's making $15,000 to $25,000 and they have tremendous health care expenses, then they're going to be more responsible for more of their health care costs. And the dollar doesn't purchase as much as it used to, so having individuals pay more for their health care costs is not going to be very popular. Allowing middle-income seniors to buy insurance as a group, thereby creating greater purchasing power when dealing with drug companies, and creating tax-free medical savings accounts, including a $3,000 stop-loss limit. So, again,
What is a stop-loss limit?
stop loss would be, for instance, if you had medical expenses done over $3,000, then at that point in time, then they would cover the rest of that. So, again, though, if under $9,000, and you take $3,000 of that for your drugs and expenses, which the elderly have all the time, then you're looking at something that's not very feasible, you know, for somebody. So. Now, one of the things that has really created the problems that we're having right now with healthcare entities is the Balanced Budget Act of 1997. I think, you know, people say, well, what happened with our healthcare industry? Back in 1995-96, there were a tremendous amount of abuses of the healthcare system. I don't know how many of y'all are aware of home healthcare and all the abuses that went on with that. And also there was the fraud and abuse with regards to hospital payments and abuses of DRG creep, where they would try to change a DRG coding for another one. Ethical issues that has really hurt the healthcare industry. Well, Congress said we're tired of that, and so we're paying out all this money to these individuals, and we shouldn't be paying it out, so we're going to do something to the healthcare industry. So what they did, they cut $112 billion out of reimbursements to hospitals and medical care providers. And this pretty much crippled the healthcare industry. I think right now, because of this, you see a lot of hospitals are merging. You see a lot of hospitals that are gradually going into debt, especially poor performing ones. And the Congress had realized that, and they've given a few billion back, but they're reducing co-payments on outpatient care, and supposed to improve coverage for such preventative tests as mammograms with this $30 billion that they're putting in. But folks, when you take out $112 billion and you put back in just a little bit, then you can see that the healthcare industry is in a real problem. So Congress, I don't know, in their willingness, you know, to try to hit the healthcare industry, really hurt it, and in turn hurt the patients. I know my mom, who is an invalid, received home health care treatments, and then when they cut back on that, when they said, okay, you know, home health care, you can only get a certain amount over the year, then that meant that she had to pay additional monies for home health care. And my mom was a victim of the excesses of the providers in home health care. So that's sad. Now, Medicare prescription benefit. Bush plan's called immediate helping hand. And what he is planning initially is $48 billion over 4 years to help states cover drug payments for low-income seniors. Individuals with income levels over $15,000 would get no assistance. Now, you can see right there that there's a real issue with that, and it kind of makes you think, well, where is our, and I'm not a Democrat or a Republican, but I kind of have to laugh at the compassionate statements of the Bush administration. I hope that they don't send somebody out to shoot me. Neither would couples with incomes over $19,700. Again, this is the proposed from the Bush, okay? Now, again, folks, as you can see, drug cost, and they've got caps on it, like, for instance, I think with Bush is if you had medical care cost over $4,500, then at that point in time, then they'll cover you. Well, can you imagine what $4,500 takes out of $19,000 and whether or not you're going to be able to survive? Who knows? I don't think so. During the campaign, Bush promised a $110 billion drug plan that would pay 25% of drug costs for all seniors. And he is backing down a little bit and saying a longer range drug plan is to be sent to Congress later. Families USA, which represents the public, says that the plan is flawed, and I think that you can see from those comments from Bush in terms of his administration's dealing with prescription drugs, it's going to be very, very difficult.
They realize it's such a vicious circle. These families that have $15,000 or less, even if you have $9,000, if you spend $500 or $600 a month on medications, what they end up doing, because they can't pay their utilities, they can't pay their other bills, so they quit getting their prescription drugs filled, then that puts them in a hospital or a long-term care setting or needing home health because of all the other exacerbations of their disease processes.
Right.
And it's a vicious circle that it's like they don't consider what's going to be the outcome of making these people pay for prescription drugs that they can't afford.
I know it. And if you look at this plan and you see that all of the flaws that's in it, which you can recognize it almost immediately, then at that point in time, then you say, well, what can we do about this? Well, what you can do about that, like I said earlier, Donnie, is that you really have to be in contact with your congressman and let them know, that this is not acceptable. But you look at healthcare costs and how they're escalating, and the type of healthcare that's being delivered, in the United States today, and it's very scary, because even here in the state of Texas, you've got education priorities, you've got prison priorities, and now you've got additional Medicaid patients that are coming on that they've had to identify. And so, where are the priorities, where the money's going to go? And that's just with the state Medicaid. That's not even with Medicare. And so the federal government is at a situation, and if we do go into a recession, and all that surplus that we're talking about, shoring up Medicaid and shoring up Social Security, it's just, it's very scary. As just some of the assumptions that are being made, if I could show this slide here, just what is this budget surplus stuff that we've been talking about. Current estimates are, now this is the plans that they've got for prescription, and this is the plans that they've got for Medicare, et cetera, and this $30 billion and various other that they're putting in. If the economy continues along its current path, uninterrupted for the next 10 years. So what we're looking at, folks, is that we've been in a very prosperous time the last 10 years, and so the projections, they're using those projections as reasons for being able to do the things that they're going to try to do in Congress. If employment remains low and people continue to pay taxes into Medicare, Social Security, and if inflation remains low, well, I think we're wondering about whether or not Greenspan is going to say that we're in a recession. Then maybe the nation could enjoy a budget surplus over the next 10 years in the ballpark of $4 to $5 trillion, $2.2 trillion, which would be Social Security to begin with. So the assumptions are, if our economy's still heated up and we're still making a ton of money, then we're going to be able to cover Medicare and some various other things. But as it says here, the old Killjoy Alan Greenspan says, boys and girls, don't spend it until you got it. There are too many ifs. And so, as you can see right now, folks, we're a little bit concerned about what's happening with regards to our economy because it's cooling down considerably. Now, some of the buzzwords that are being used right now in Congress is one of them is backspending. Backspending describes the budgetary impact of spending or tax-cutting activities is estimated to occur after the initial implementation period of any new proposal, health proposal. Example, the GOP estate tax elimination is said to cost only $15 billion over the first 5 years, but accelerates to as much as $25 billion a year after 10 years. So, backspending, folks, is essentially saying, and an example, the Democratic-sponsored Medicare or medical proposal is said to cost only $50 billion, drug proposal, excuse me, only $50 billion in its first 5 years, but that much or more each year after 10 years. So what they're looking at is a 10-year time frame. And so we can expect, am I okay? Am I moving that too much? Okay. Okay, I'm sorry. So as you can see, Congress in its wisdom is looking at 10 years out and also trying to make some predictions based upon the economy, which is based on 10 years later. Another is pay word that they're using, or buzzword that they're using in Congress is pay-go. Is the term used to describe the suggested government spending policy that new benefits and or new tax cuts should be limited to funds actually available and should be reviewed or sunset on an annual basis rather than institutionalized into the nation's social and tax structures. Example, tax rebates could be given on an annual basis based upon actual revenues and funds. Example, a Medicare prescription benefit could be added on a demonstration basis subject to experience and funded forward only as funds were available. So what they're saying essentially here is that you would get a prescription benefit, but if there wasn't enough money in, then your prescription benefit would drop and you wouldn't get as much. And so there's all kinds of games that are going on within the healthcare industry, within Congress, excuse me, trying to figure out the games in the healthcare industry. Now, I've jumped through this pretty quick because usually I like a lot of discussion on this, folks, and I'm sorry for taking the break, but this is pretty much the end of my presentation. I think, you know, when you consider delivering cost-effective quality health care to all Americans, then there's still some issues that needs to be considered by our leaders. One is the unmet needs. We've got 42+ million remain uninsured in America. How are we going to restructure Medicare for the boomers and beyond? I understand that in the year 2010, 75 million additional Medicare eligible people will come on the rolls. That is a big group. Then build the HealthCare electronic highway. Any of you who've dealt with a computer know how difficult that is. A situation where you're going to try to integrate all those various entities that I showed you earlier is just a gargantuan task, and the issues of privacy, cost, and various other things are just almost overwhelming. I think eventually we will get there, but it is going to be a very, very difficult road. Clinical systems and outcomes, I think that we can say that managed care has not done what it was touted to do, primarily reduce cost, but I think the American public now is a little bit concerned about the quality of care that they're receiving. And now it comes down to clinical systems and outcomes where you have report cards for everybody, you have specific protocols that you will follow, and that once they determine, you know, what is the appropriate level of care, then that will be the standard for which payment is made and care is rendered. So we in the healthcare industry are, like I said, we're getting report cards, we're going to be getting report cards, And everything that we're going to do is going to be measured, and it's going to be outcomes oriented.
But it's gonna be measured by non-professional.
Yeah, right,
medical
exactly. Yeah,
personnel.
exactly. And that's the issue, you know. And I think that, you know, we, Donna, as healthcare individuals or who are involved in the healthcare industry, it's extremely important that we don't sit back and gripe about it, but try to assume, again, the leadership, you know, in terms of developing the rules and regulations and how the healthcare system is going to be, how it's going to evolve. And that means at the very beginning in terms of developing strategy and things, working with congressmen, et cetera. Whether or not we need to keep the system the same as it's been, I don't think so. Change is something that we all have to deal with. And then converting data into information, virtual healthcare. All of y'all hear about being able to turn on your television and then your computer and being able to plug in and being able to get all types of health information, contact with your doctor and with the hospital, and having everything integrated. Any place that you go in the United States, they can track you. And so that's what we're trying to, what I get a feel for in terms of what's important with regards to the healthcare industry and some of the issues. I wish I could tell you exactly what's coming out of Congress, but I can't. These are some of the things I've given you a view in terms of what the Bush administration is thinking about. And to say the least, there's a tremendous amount of concern in terms of cutting back costs for healthcare providers and putting more of the cost on consumers. And yet at the same time looking at the budget and saying, okay, we're making those assumptions that, you know, in 10 years, if we continue to bring in all this money, we're going to be able to do all these things. But if we go into a recession, the whole game changes. Now that's my presentation. I'd be more than happy to discuss any issues that any of y'all might have with regards to that. I'm sorry that I painted such a bleak picture about the healthcare industry, folks, but it's a situation where the new administration, and I think even the Clinton administration, understands that, you know, cost is going up precipitously in the healthcare industry, and it's getting to a point where the governments, both state and federal, cannot afford healthcare. And so there's issues of saying, okay, we'll make the patient pay more. Well, if the patient doesn't have enough income, then how in the world are they going to do that? So.
Well, and how can you plan for retirement when you don't know? Say if you know that you're going to retire with X amount of dollars right now, with the continued increase in healthcare costs and this pay-to-go system that says, well, you know, if we've got it this year, you can have it, but if we don't,
then
you
we're going to
can't.
cut back on it.
So how do you plan for retirement?
Well, I think what they're trying to say is that there'll be a grandfather clause, Donna. There'll be individuals that are at a certain age right now, and they're going to be grandfathered through. Okay, they'll still receive that care. But what they're trying to say is, let's have the American public assume more responsibility for their health care. Do the health care practices that keep you healthy. Understand that if you have to pay a considerable amount of that cost of health care, then you're probably going to be practicing a little bit healthier lifestyle than you have in the past. Now, that's easily said. And the situation is that as the information age increases and gets more sophisticated, then you can find out more about your illnesses and you can do more preventative things about those before it gets to the point where you have to go to the hospital, you know, for more expensive stuff.
As we increase the age that people are living, from what, say in the early 1900s, it was 42, 46 years of age for a female, and now they're living 80 plus years.
Right.
I mean, there's no way to plan for that.
It Don, scares me to death. Yeah, it really does, because I think about that, because you look at the longevity issue, and you look at right now, I think they're saying in the last year of aged individual's life, you know, they use 70%, you know, of the cost is in that last year. And as you get older, and Americans are living older, then, you know, the retirement age, you know, I know for me, for instance, it's going to be 66. And the 67 will come along, and then the 60, it'll keep going up, you know. And the issue is that the young people past the baby boomers, and the burdens that may be placed upon them, you know, to support the baby boomers and support the aging population, growing aging population, is a real issue, and it's something that Congress, in these times of making that you saw the two differences in the election, where, you know, the election was real close. You have a group of Americans who feel like that, you know, healthcare costs need to be controlled, but then you have another group of Americans who are at the mercy, as we were talking earlier, you know, the income levels and the medically indigent, you know, what's going to be happening to them. And that's when they sit in here, you know, well, are we going to have a system, maybe a three-tier system, where those who have money will have the best health care? Then in the second tier, then you'll have the individuals that have health insurance through their companies and everything else. Then you'll have the third tier, which will be for the individuals who cannot afford insurance. And then, is that appropriate in America? Do we have that type of difference, you know, in terms of a social responsibility of the U.S.? I don't know. Is Del Rio out there? Veronica, are you out there? I guess I'll put her to sleep.
This is Shirley. I'm in Del Rio.
Shirley, are you with Valverde Memorial Hospital?
Yes.
Would you be sure and tell Luis Garza I said hello?
Sure will.
Okay. He's getting ready to come into our executive program, and we're really excited that he's coming in at Trinity University.
Oh, that's great.
Yeah. Debbie Scott, are you there? I was going to ask her what she thought about the Bay Area hospital people. We got some of our graduates who are administrators in there, but I don't think we should say it over the line. Lily, that's all I have, young lady. Are there any questions or comments or anything else that anybody has? Again, I'm sorry for such bad news, folks, but I'm hoping it'll get better. Lily, what do I do now? Do I just pass through the portals or what?
This is El Paso.
Yes.
I have a comment. I
Yes.
think you presented a very realistic picture and gave us a lot to think about. Your presentation was excellent.
Oh, well, thank
This
you.
is Rosemary.
Oh, okay, Rosemary. Thank you very much. This is the first time I've done it on teleconferencing, but I've never done it on video conferencing. And I usually, when I make a presentation, I get in the middle of the crowd and I get them all incited and everything else. So at a distance and everything else, this interaction sometimes takes a little bit of getting used to. But I appreciate very much your comments. Again, I wish I could have given you all some more concrete information about what's really going on in Congress. But as I said earlier, with the new administration, Lord knows what they're doing right now. But thank you. I appreciate your comments. Why don't we take a short break, a 10, 15-minute break, okay? And I wish you folks the very best and hope to see you down the road.
What goes up must come down.